as you know, in my previous talks, I like to talk something which is my own experience. My own experience doesn't become applicable everywhere. One swallow doesn't bring Indian summer. But nonetheless, I feel satisfied because then that is something tested, which I'm giving it to you. So I will briefly talk about my sojourn with the diabetes uh, for almost since 2009, when I was first found to be diabetic. And the story was that I was working in India, and always I had the privilege of working in the hospital. So I was working in one of the major institutes in India, and one day we were free. So I said, let me do my labs. And I was shell-shocked to see 300 was my sugar and 9.2 was my glycated hemoglobin. There was no family history of diabetes, and I never thought I'll have diabetes because I was in a euphoric phase. I have been doing exercise for 30 years, and I thought that gives me license to not to have any of these lifestyle diseases. So let us talk, how did my journey go with it? This talk is dedicated to my dear wife, Sushma Bhandari, because most of what I'm talking is not my 50 years of medicinal knowledge or allopathy, which was very hard to do. Most of it is the lifestyle issues, which she was instrumental in researching it for me. And only thing is, I did not question the logic. Most of them were not evidence-based, which was very contrary to what I learned. And that's why, welcome, Dr. Bhandari is here, Sudhir Bhandari is here, and we welcome him. So I divide my journey of 2009 to 11 years into 3 phases. First year was ignorance. I was illiterate, despite being literate in medicine. I knew that these diseases happen to others, not to you. And my lifestyle was very hectic. I would never sleep in Delhi or India whenever I come over a night in one place or 2 nights or a weekend with my brother. And hectic travel style, I have made 3 cities in a day, and diet and all were ignorant, but only thing I'll be careful about doing some exercise. So that was a phase I call of ignorance. Then I got shocked. So I called one of my friends and consulted one of the best endocrinologists in Mumbai. And I was a very obedient patient. And I followed the doctors in letter and spirit. And it was a period of total dependence. Total dependence. I didn't apply my mind, and doctors did tell me the usual, and I knew that I have to do diet regulation, exercise, but there was no quantification of it. I did not know what is needed for my body. And then about 2 years ago, I said this is not working because the medicine was going one way, up and up, medicines were added, sugar was not controlled, glycated hemoglobin, as I'll show you. And then I decided to take control of my life. And that's where I continued. But mind you, I never took vengeance on medicine or did anything which is beyond my doctor said. Everything was done. When I stopped the medicine, it was a decision of my doctor. He said, you don't need the medicine now. We will continue checking you. So this is why glycated hemoglobin. I deliberately decided not to do this webinar till I get 3 monthly report. Mind you, from 9, which is not in this graph, it has come to 5.8. Now, everybody likes the word cure, but I have a very different view about cure, having practiced medicine for so many years. Cure satisfies us. We want to hear this from doctors like Sudhir Bhandari. Can I cure my diabetes or not? But I think cure should not be really, it's a temporary victory over death. So all I would say that can I live with peace and a good quality of life, change the narrative, don't focus on cure. That nothing can be cured, only death will cure everything. So my drug treatment, Dr. Bhandari I'm giving him a lot of meat to really talk on my case report and analytically say what I did wrong or what I did right. In the sense that medicine, I have found, is an escalator, because patients don't do their component and doctors, rightly so, go on increasing the medicine. So I was on 2000 metformin. I had one of the best endocrinologist access, and he said, let's add it Januvia. And I had Januvia, and the sugars would continue to be never so high, but not to my liking, anywhere between 130 to 150. And glycated hemoglobin was hovering around 7 and 8. And doctors would tell me, oh, the limits for glycated hemoglobin has gone up, you don't have to worry. First thing I changed in last 2 years, and I strongly believe, and I want you to really think, that belief system is very important. Don't do anything, because believe me, in my practice, when you go to a doctor, more what works, the best medicine is your belief in him. If you don't trust him, please change the doctor. If you don't trust the medicine, don't take it. But belief system is something which in my case has worked wonders. Change your mindset. Very easily said and done. Everybody tells, and everybody, the intellects which is listening to the webinar, knows about it. Change from reactive to proactive mind. It's a long journey. It's an unending journey. But somewhere you have to begin. And you have to think, and there are many ways. We don't want to go in the ways. It's trial and error, but you have to understand one fact, because this all contributes. It's a hidden impact on your disease condition and diabetes. Placebo and nocebo effects. I'm very fond of this thing. Bruce Lipton had given this idea. Placebo is one which is a fake medicine. There is no medicine, but people trust the doctors or a medicine. And we do in clinical trials that we give sugar-coated pills of the same color to check the effect of the medicine. That is more of your psychic impact. You believe that this is going to work, that is placebo. More important in COVID times, with the media industry on top of the game, is the nocebo effect. Equally, your negative environment, negative listening to the news, negative think about you. Oh my God, think of the worst. Diabetes means I will have heart disease, I will have kidney disease. All this negative thing really makes, according to me, nocebo effect writes your future astrology, your future horoscope. First thing is physical activity. And most important thing in physical activity is how much you do. There is no prescribed thing. You'll have to titrate it. And I used to titrate it with my sugars and my diet, because I didn't want to starve myself. So in last 3 months, I jacked up my physical activity. And this is my yesterday's thing. Today I can go, I'll go it, 6.29 miles. And I keep a tracker which keeps my body weight under control. And all of you can do. MediCounsel is going to start very soon a system where we'll monitor your health sitting at home without your doing anything, so that you can intelligently go to your doctors. The morning thing is, again, the supplements can be questioned, but I know that known antioxidants are turmeric, which is Indian thing, haldi, cinnamon, lemon, that's my morning. And then a green smoothie or anything, fruit and green leafy vegetables you can have. This is up to my lunch. And then I have a big salad. Avocado is not necessary. I take it because that is the only source of fat I like. Otherwise, fat is practically zero, except for little fat we take. Biggest thing in Indian diet, which I found difficult, was cutting carbohydrates. We have sweet tooth. We have chapatis are staple food, but I had cut, and I was very fond of breads and buns and all, but I had cut. That is very difficult thing for me to do, but I did it. And sleep, one of the most important thing I would say, don't underassess that however busy you are, totally you should minimally sleep well for 7 hours. And sleep becomes, insomnia is taken care of if you jack up your exercise to reach to a thing. This is what we did a survey, just to give you idea of the magnitude of the problem. This real survey for this webinar we did, where we had close to um, 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 300 people, 63% females were diabetic, 89% of them were non-diabetic, 10.2, which matches with the overall data what I have seen. A family history of diabetes, this is very important. That family history of diabetes, I would like to take some time. 47% of them have family history of diabetes. Now, mind you, we cannot choose our parents now. But don't believe too much in genetics, since the field of epigenetics have come. We can change our genes, because genes have been documentatedly proved that the environment affects the gene. And remember my slide, wherein I said that it is all your nocebo effect which affect the gene. So if you continue with lifestyle changes, we have a very strong family history of hypertension. My father was a heart patient, and but that doesn't make any difference. I don't want to believe that I will have that condition. So these are the people they should be called, and I won't really exaggerate. If you consider yourself to be potentially diabetic, nothing to worry, nothing to do, but pull up your socks and get into lifestyle changes. This is another thing. Diabetes is one of the best diseases in my practice I have seen, if you don't let it friendly with other organs. But unfortunately, once it is complicated and it involves, Dr. Bhandari will tell you much more on high blood pressure, 9.4% in high blood pressure, and more than over 10 years are 25.8. As you grow, organ of end organ damage increases, and how should you guard? So it's not diabetes. You have to guard about 7.5% at heart disease, and kidney problems almost to the tune of 3 to 4%, and multitude of combination and permission. Stroke, again, mind you, in the rural area, we have no idea about the problem. It's like COVID. When you don't have the actual 100% population testing, it is very, very erroneous to calculate the mortality on the basis of the test, 40 million tests or 40, whatever is number they have been done. But what I want to tell you is that many patients present just first symptom as a stroke. They never know. One of my cousins was 2 days ago sent me a report with the raised creatinine and kidney damage. And he says he has no problem. And then when I sent him to a nephrologist, told me, sir, he's hypertensive for 18 years. He is neglected. Mind you, if you don't look after your health positively, doctors will find it very difficult to support you. 3% of them insulin therapy, 8% on diabetic treatment. Now, with this, I'll hand over to Dr. Bhandari, but all I would like to say, in general, that medicine is the game of partnership between doctors and you. Doctors, Indian doctors are excellent. I'm biased about it. But until the patient does it component, doctor cannot come to your home, because you go to a doctor's chamber once in 3 months or to a hospital, get a blood sugar done. If it comes out to be normal, you feel everything is hunky-dory. It is not. There is a lot of component you have to do for yourself. With this, I hand over to Dr. Bhandari. Thank you very much.